Good afternoon, Campbell Macroney. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps nurses update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your roleplay.
Good morning. I am Nurse Campbell Macaroni. Am I talking to Mihiraa?
Good morning, nurse. Yes, I am Mihiraa.
Hello, Mihiraa. My main reason for visiting is to check on how your surgery wounds are healing since you left the hospital.
Thank you. Please come in.
Thank you for having me in your home today. I can hear a little bit of worry in your voice, and that's completely understandable after an operation. First of all, how have you been feeling over the last 10 days?
Oh, well, I've been okay mostly. I'm just a bit tired, and the area around the cuts is a little uncomfortable. I'm also not entirely sure if I'm doing the right thing with the bandages.
It's very common to feel a bit tired and have some discomfort, and it's good that you brought up the bandages. To help me understand how things are going, could you first talk me through what you currently understand about looking after your dressings? For example, how often have you been changing them, and what steps are you taking?
Well, I try to change it every other day, like I think they said. I make sure my hands are clean before I touch the new plaster. I've been trying to keep it dry when I wash, but I'm not sure if I'm doing it correctly. And the little bit of soreness makes me nervous.
You're doing some of the right things already, which is excellent. While we're on the topic, I need to ask about some specific symptoms. Besides the general discomfort, have you noticed any particular signs around the wounds themselves? For instance, any significant redness or swelling, any liquid coming from the site, or has the pain become much worse? Also, have you had any fever?
The skin around it is a little pink, and there is a very small amount of a yellowish liquid on the dressing sometimes. The pain hasn't gotten worse. It's just there. And no, I haven't felt feverish at all.
Thank you for explaining everything so clearly. Based on what you've described, I want to reassure you that these symptoms can be completely normal during the early stages of wound healing. It's quite common to experience mild tenderness around the area, especially as the surrounding tissues settle and begin to repair themselves. You may also notice a bit of bruising or a very small amount of clear or slightly yellowish drainage, and that can simply be the body's way of clearing out normal postoperative fluids. These signs on their own are usually not a cause for worry. It might help to understand exactly why the dressing is so important at this stage. The surgical wound dressing acts as a protective cover, shielding the incision from irritation, bacteria, and accidental touching. It also absorbs any small amount of normal drainage so that the area stays clean and dry, which is vital for proper healing. Most importantly, the dressing helps reduce the risk of infection by creating a controlled environment where the tissues can heal safely and steadily. When the wound is protected in this way, your body can focus on rebuilding the tissue underneath without unnecessary stress. Please remember, your symptoms at the moment fit very well with what we expect after this kind of procedure. I'll keep assessing everything closely, but for now, what you're experiencing sounds very much within the normal healing range.
That's reassuring to hear, nurse. But I'm still a bit worried because the area feels slightly warmer today than it did before. Is that something I should be concerned about?
Now that we've talked about how the wound looks today, I'd like to guide you on what to expect as it continues to heal and how you can manage it safely at home. When a surgical wound is healing well, there are a few positive signs to look out for. You should notice that the discomfort gradually decreases over time, the wound becomes drier with less or no drainage, and the edges take on a healthy pink color. These are all normal indicators that the tissues underneath are repairing in the right way. To support this healing, there are some important steps you can take. Make sure you change the dressing exactly as you've been instructed every second day, unless it becomes damp or dirty sooner. Each time you handle the dressing, wash your hands thoroughly both before and after. This simple step is one of the best ways to prevent infection. Try to keep the area clean and completely dry, especially after bathing. If you experience discomfort, it's perfectly fine to take the pain relief medication that was recommended for you, as this will help you stay comfortable while your body continues to heal. There are also a few things to avoid. Try not to touch or handle the wound more than necessary, as this can introduce bacteria and slow the healing process. Also, avoid wearing tight or restrictive clothing that may rub against the area and cause irritation. Loose, breathable clothing will be much more comfortable and protective.
Thank you, nurse. I've been trying to follow those steps, but could you tell me when I should seek medical help?
As you continue caring for your wound at home, it's really important to pay attention to how it changes day by day. When a wound is healing in a healthy way, you'll normally notice that the discomfort slowly decreases, the area remains mostly dry, and the skin edges develop a healthy pink color. These are all reassuring signs that the tissues underneath are repairing as expected. At the same time, I want you to be aware of the symptoms that require immediate attention because recognizing them early can make a big difference. Please contact your GP straight away if you notice anything that suggests an infection. This includes developing a fever, seeing the redness spread, or the skin around the area becoming unusually warm, or noticing any thick, yellow or green pus-like discharge. Another warning sign is pain that becomes intense or persistent, especially if your usual pain medication is no longer helping. These symptoms can indicate that the body is struggling to manage bacteria in the wound, and prompt medical review is essential. I strongly encourage you to check the wound once a day and continue following all the postoperative care instructions you were given. Monitoring the area regularly helps you pick up any early changes before they become more serious. It also supports faster healing by ensuring the wound is protected and managed properly and reduces the risk of complications. Consistent, attentive care at home is one of the most effective ways to keep your recovery on track.
I understand, nurse. I will take care of it.
Now, to get a proper look myself, would it be okay with you if I change your wound dressing for you today? This will allow me to check the wounds directly and show you how to do it.
Yes, that would be very helpful. Please go ahead.
Thank you for the consent. Now, let's get that dressing changed for you.